Here is a case of 4 years child female baby where stone was there in the pelvis, failed RIRS, subsequently did supine PCNL. The problem is the stone was there at the pelvis. When the flexible scope entered, it went into inferior calyx. And subsequently we could not see. This is the small urethra in children. We have gently dilated up to 12 French. As like any other RIRS, first is 6 by 7.5 scope ureteroscopy. This was the stone. It was easily seen, and suddenly when we are doing ureteroscopy, it disappeared naturally with water, and then we passed two guide wires, and then flexible scopy done. Once we went inside, already this is the upper calyx. For some time the stone is not seen, surprisingly, which was seen with rigid scope. That means from pelvis it has gone into inferior calyx like this. At this stage we attempted the basket. The more the basket touched the stone, more it has gone into the medial part of the calyx. The best of the experience, the maneuvers, the stone could not be delivered out, unfortunately. The message we wanted to give is that if it is 2-3 minutes, if you cannot get it, see, suddenly it gone into so medially calyx that you are not able to do anything. Then contrast injected. Even though the calyceal system appears so much dilated, the flexible scope has not gone. This was live workshop 4th Saturday last week. Then we immediately went into the supine PCNL. See, initially this angle was not working out, and after that we changed the angle a little bit, a little below, and then kidney is moving. That's a very good part of the supine PCNL. Sometimes if the water doesn't come, don't inject contrast, just pass the guide wire, which has gone into the ureter luckily, and slowly, very less angle, gentle dilatation is done. And after that, intermittently checked whether any leak of the contrast is there, because one should be careful in dilatation in children. This is supine PCNL. Very clearly the stone is seen. The guide wire is removed. Mini-perc coral starch is instrument, 15 French outer sheath, 12 French nephroscope. Vision is good. Gentle flushing from below is done. And the stone is powdered. And all the fragments come out usually either by suction or by gravity, till the stone is made last powder. It is pulverized with 1 joule and 10 Hz thulium fiber laser. This is relatively best setting for the fine fragmentation or dusting, for both. So when the stone fragments are small, they are removed with the forceps for stone analysis also. Now at the end we have put the stent. So sometimes RIRS in children may fail because of the acute angle like in adults. Message is too much trying, too much spending time in intra-renal region is dangerous. So better to switch to supine PCNL or prone PCNL. And the child post-operative day 1 recovered completely and discharged. This is the video showing the child walking day 1 and discharged. Thank you.